Hi, my name is Dominique Alvarado, and for my science highlight presentation, um, I found an article by the Nutrients Journal published in February 2023. It's titled Eating Vegetables First, Regardless of Eating Speed, has a significant reducing effect on postprandial blood glucose and insulin in young, healthy women. It was a randomized, controlled crossover study. So first, we're going to go over some background on this topic, more specifically on the effects of postprandial glucose elevation and diabetes, and how this ties in with eating speed and eating order. We'll go over our design of this study, some key findings, and then we will move on to a discussion at the end. What is the importance of postprandial blood glucose control? What is postprandial glucose control? Postprandial means after eating, and glucose control relates to how rapidly blood glucose rises after a meal. So lack of this postprandial glucose control can be a factor in getting diabetes and is an exacerbating symptom after the diagnosis of diabetes as well. When postprandial glucose controls are, blood glucose levels are not controlled, incidents of complications of diabetes are common. You can think glaucoma, renal failure, and diabetic neuropathy happen when you have high levels of glucose in your blood. Diet change is typically the most prevalent intervention for this, but it's difficult for participants to adhere for extended periods of time. The authors of this study noted that the results of some Mediterranean and low carbohydrate diets related studies had proven that weight loss and lipid profiles had improved, but after 6 years, 11% of the participants had changed to a different diet, and 22% had actually quit dieting altogether. So, how are eating speeds and eating order related to this? Well, fast eating speed has a positive correlation with weight gain. So, the faster you eat, the more weight people tend to have on them. And eating speed can be a cost effective, efficient practice for weight management. A lot of people will recommend changing eating speed, like eat slower, you'll feel fuller faster. But this isn't very practical to do when you're instructed. If someone tells you to eat a meal within 20 minutes, no shorter than that, it's really difficult, especially if you're really hungry, right? So that is why we're focusing on eating speed. And they focused on eating order because recent studies have shown that preloading vegetables will lower postprandial glucose spikes, which we kind of did touch on in class. Higher fiber foods like vegetables are consumed, gastric emptying because some hormones are secreted, and we won't digest that as quickly as, say, just a simple milkshake or something sweet like a candy bar. So their purpose of this study was to examine the acute effects of different eating speeds with different food orders on postprandial blood glucose, insulin, triglycerides, free fatty acids, and their concentrations in healthy young women. So this study had 21 participants originally. Participants were also free from eating disorders, metabolic disease, other diets, and any other medications. But they ended up with 18 college-age women. This was an unblind, randomized, within participant crossover design where all the participants consumed identical meals on 3 separate days a week apart. A crossover design is considered one of the gold standards of study designs. All of the same participants did every single type of this study, but they just had those meals a week apart. And after a 24-hour fast, participants were instructed to eat boiled rice, tomato, and broccoli with sesame oil. and frozen box fried fish. So if you want to take a look with me at the study design, we had some slow eating with the carbohydrate first as the first week, slow eating with vegetables first in the second week, and fast eating with vegetables first in the third week. And so the first week, they were instructed to eat within 20 minutes and they had to eat the carbohydrate first. Then, at the 30-minute mark of them starting to eat, their blood glucose and all those other fun tests were taken. Again at the 60-minute mark, and then again at the 120 mark. Then, the second week, they were instructed to eat slowly, but with the vegetable first, meaning the broccoli, tomato, and sesame oil concoction. And then the third week, they were instructed to eat fast with the vegetables first. And so the blood glucose, insulin, triglyceride, and free fatty acids were all displayed here on these graphs where we can also see the timestamps of 0, 30, 60, and 120 minutes. As you can see in this blood glucose graph A, slow eating with the carbohydrate, meaning the rice first, had a more significant effect on blood glucose after eating, as well as our insulin spike. We saw that the slow eating with the carbohydrate first was a lot higher in insulin secretion than the other two groups. This was not as significant. And in the triglyceride levels, we also saw that slow eating the carbohydrate first had a significant difference from the rest of the group, but this time it was lower than the other groups after 120 minutes. And there was no significant difference between the free fatty acids in these groups. So, what are some of the mechanisms of action behind this experiment? Preloading fiber might be beneficial in reducing postprandial glucose response, and this might be due to the secretion of incretin hormones that delay gastric emptying. And this also could have taken place with the sesame oil that was consumed with these vegetables. So, current medical nutrition therapy does not include eating vegetables first, then the main dish, only a diet change, which we spoke about earlier. One of my follow-up questions to you would be, do you think that the medical nutrition therapy recommendation should include eating vegetables first, then the main dish? Or do you think they're right in only suggesting a diet change? Another point is changing the order of eating a meal is more effective in reducing blood glucose than the speed of eating the same meal. So, as we saw, if you eat vegetables first, you will have lower blood glucose without depending on how fast you eat the meal. But I ask you this question. Do you think eating vegetables first is a better solution, or eating fast or eating slower to reduce blood glucose? In conclusion, the study had demonstrated that as long as vegetables were eaten first, eating speed, whether you ate slow or fast, did not affect postprandial blood glucose and insulin concentrations when an appropriate amount of vegetables are consumed. That being said, it's really difficult in our Western style diet to get enough vegetables, especially if you're eating a hamburger or something that is a mixed food. Their results provided a more practical approach for the prevention and management of blood glucose, and I found that really fascinating. I hope you did too. Thank you so much. I hope you have a good day.